can anyone apply for this private health insurance?
Are you allowed to say like the batting average of like approvals versus denials?
Predominantly, we most of the time.
So for some of the people in the US, their insurance covers their medication.
Yeah, so that's a very good question.
That's a good idea. WhatsApp.
So it gives me an excuse to go travel outside, outside the Philippines.
An excuse to test your insurance? That's great.
You should keep that part in.
I'm talking about at war. In this video, we are talking about pre-existing conditions and if you qualify for the private health insurance so that you can get a visa to live in Spain.
We're here with Ciaran O'Toole from InnoInsure. And Ciaran, thank you so much for being here.
Hi Paul, hi Bea. Thanks so much for having me on. Great to see you again. Hopefully in this video we can provide valuable information to clients here in Spain or looking to move over to Spain. So as you mentioned, my name is Ciaran O'Toole from InnoInsure. We're an alliance of official international offices, the leading health insurance companies in Spain. And we have health insurance policies that meet all visa requirements, including the Spanish visa, digital nomad visa, non-lucrative visa, golden visa, and NIE applications and renewals as well. So looking forward to it, and hopefully we can provide helpful information to the viewers.
Since our previous video with private health insurance with Ciaran, we were getting a lot of questions regarding pre-existing conditions, and we understand that the non-lucrative visa is geared towards retiring people or retired people. And I mean, obviously, if you're a little bit older and you have pre-existing conditions, this is probably top of mind. So today we are gonna ask about the insurance products that he covers and ask him if pre-existing conditions are covered.
Right, because it's funny because whenever I go online, especially in Facebook groups, and all of these people are asking about pre-existing conditions, and when you look at the comments, every single comment is just posting a link to an insurance agent or an insurance company, but they're not really answering the questions. So today, we actually invited the best insurance agent that will hopefully answer your questions.
So let's get right to it. So Ciaran, are pre-existing conditions covered with your insurance products, DKV and ASISA?
Yeah, so that's a great question. So it's a case-by-case basis. So we'll request some information, some details on the pre-existing conditions. We'll then submit them to the medical review team of the health insurance company. Once they confirm the details, they'll provide the price and also the details of the coverage. So once accepted, pre-existing conditions are covered and included. So that consultations, checkups, x-rays, they're all covered and included. And you can just go directly to the doctor for that. For more high-tech examinations, surgeries, hospitalizations, you'll need authorization. And this will depend on the authorization of the conditions. Although consultations, checkups, that's covered and included once the medical review team have confirmed the policy for you.
Okay, so it's not a complete no, is what you're saying, right? It depends on what they have and it will be reviewed by a medical team.
Yeah, exactly. And then once confirmed, they're covered and included. As I mentioned, consultations, checkups, you can just go directly to a doctor regarding your pre-existing condition or pre-existing condition, and that's covered. And then for the surgery, high-tech examinations, you'll need to authorize it, and then that just depends on the authorization department.
Okay, so can we talk about, well, are you allowed to say like the batting average of like approvals versus denials?
Predominantly, we most of the time we cover pre-existing conditions and they're included. Although as I mentioned, it's just a case-by-case basis, and each case is different. And it just depends on the pre-existing conditions. If they're very severe or there's many pre-existing conditions, it might be more difficult, but we'll always submit it and we'll always try. But more often than not, the medical review team accepts the claim.
Okay, I mean that's a good maybe.
If you're looking for the visa, if you're looking to apply for the visa, then that's a good option. So, but does that mean that the premium will be different.
Yeah, exactly. So if you have pre-existing conditions and it's accepted by the medical review team and we can provide insurance cover for you, which happens more often than not, the medical review team sets a premium based on the pre-existing conditions, which is going to be more expensive. But as I mentioned, it's going to cover the pre-existing conditions. So you're paying a premium to include the pre-existing conditions, and we do not exclude pre-existing conditions. The medical review team will either confirm or reject the pre-existing conditions. We do not exclude the conditions.
So for some of the people in the US, their insurance covers their medication. So is that the same case here in Spain?
Yeah, so unfortunately with their health insurance policies, medications or prescriptions are not included. So they must be paid for out of pocket, which from my own experience is the most common thing here in Spain, that medications or prescriptions typically aren't covered with Spanish health insurance policies and they must be paid for out of pocket, unfortunately. Also, on the other hand, medications and prescriptions in Spain, in most cases, are cheap than a lot cheaper in some cases than medications in the US and also other European countries. So in comparison, the medications here are a lot cheaper than in other countries around the world.
Okay, so knowing that, I'm curious now if are all the medications in the US available also here in Europe?
Yeah, so that's a very good question. This also depends on the medication, and there's of course different types of medications, but typically when you go to a doctor here or a specialist, they'll be able to help you with the medication you need. Either it's the same medication or they might be able to offer a different medication as well. But once you go to a doctor, they'll always be able to help.
And then thinking about people who are here now in Spain on an NLV or in a non-lucrative visa, most of them are retired, they're not working, they want to travel a lot. Is travel insurance or like when they travel, is that also covered by their insurance?
Yeah, that's a very good question. So with our health insurance policies, you have emergency travel assistance covered and included. So what that means is if you travel anywhere in the world except for your home country or countries at war, you will be covered in emergencies. So the health insurance will cover that. And so you travel all around the world to different EU countries and other countries except for your home country where you're from, you'll be covered in emergencies.
Sounds good. So it gives me an excuse to go travel outside outside the Philippines.
An excuse to test your insurance? That's great.
Okay.
So I'm the kind of person that doesn't really read all the policies because you guys give us a lot of things to read. So now I'm curious if mental health, is it covered by insurance?
Yes, exactly. So a psychiatrist and a psychologist, these are both covered. So firstly, you'd see a psychiatrist, and then if they feel it's necessary, they'll prescribe you sessions with a psychologist. You'll have to request this from the psychiatrist. The psychologist, then you can visit them and you'll be seeing.
Actually, since that's covered, now I'm curious because when we first moved here, I've been looking for that in our plan, but there's not a lot of English speaking therapists. So have you seen more English speaking? Do you guys have an option for that, an English speaking therapist?
Yeah, so predominantly with private health insurance, you have more options of English speaking doctors. And with the health insurance company, typically on the search function, there's an option to filter by language. So you can choose the English languages, and all therapists, psychiatrists, psychologists that are English speaking will appear. And then you can also as well confirm with the center or clinic if they have English speaking therapists as well.
Okay, and then you guys confirm this, right? You guys know, because the reason why I ask is because our last health insurance, when I do the filter and they say they're English speaking, and then I go to the doctor and I ask like, "Hablas Inglés?" And they're like, "No." So I'm like, "No." So this one,
Yeah,
yes.
yeah. So it just depends on the center and the clinic. With the search function, you can filter and that should be correct. You can also just confirm with the center as well via phone, email, WhatsApp, and just confirm. But that should be correct.
That's a good idea. WhatsApp. Okay.
So, Ciaran, we are always talking about this private health insurance because it's applicable for non-lucrative visa applications, for student visa, and for digital nomad visa applications, all of that. Golden visa as well. But can anyone apply for this private health insurance, or do they have to be someone who's applying for a visa?
Yeah, so anyone can apply for this visa, whether you're applying for any visa, any Spanish visa, or any Spanish residency permit, you can apply. If you're also a resident here in Spain and you're just looking for Spanish private health insurance, you can also apply. So anyone from EU countries, non-EU countries can apply for this health insurance. And as I mentioned before, it meets all visa and residency requirements. And if you're here long term and you've already surpassed your visa and you have full-time residency, you can also purchase the health insurance as well.
Okay, so even spouses of Spanish citizens are covered?
So spouses of Spanish people can apply as long as they have any other passport except for a Spanish passport, because as it's a expat foreign health insurance policy for people moving or living here in Spain, anyone except for Spanish people can purchase the insurance. If you have a Spanish passport, you cannot, but if you have any other passport, you can purchase the insurance.
Perfect. So maybe like an Italian who wants to live in Spain and wants to supplement like the public health insurance with the private one can contact you guys as well.
Yeah, exactly. So if you don't need here or living here and you have public health insurance, you just want supplemental or extra private cover, then you can purchase the health insurance, no problem at all.
So now it just gave me flashbacks on when we were trying to apply for this visa and we were trying to compare all of these companies. There's so many healthcare providers in Spain that I was wondering what are the things that we should look out for, like people should look out for when they're comparing and choosing these healthcare companies.
Yeah, that's really important. So first of all, it's the most important is to ensure that the health insurance policy you're looking for or you've taken out meets 100% of the visa requirements. So for example, full coverage in Spain, no co-payments, no waiting periods, no deductibles, and repatriation of remains is included. So make sure that that's covered and included. Then you want to ensure that you have national coverage or where you're moving to. For example, if you're moving to Valencia or Alicante or País Vasco, that you have the relevant coverage in that area, that the centres, doctors, hospitals close to you. So in the event of visiting a doctor or an emergency, that you have the adequate medical coverage for the area that you're staying in. And then also an important one, which we've mentioned here today regarding pre-existing conditions, is that you have coverage regarding your pre-existing conditions and there's no exclusions as well. That's really important. And also that the health insurance company that you've taken the policy with are there to assist you in terms of customer support, helping you in the language that you speak. And in this case, if you're speaking English, that you have customer support in English in the event of any questions, any emergencies. So there are a couple of things that are really important to look out for when choosing your health insurance policy.
So what makes InnoInsure different from all these other companies?
Yeah, so first of all, our health insurance policies meet all visa and residency requirements. They also both have national coverage, so that's coverage all across Spain, including the Canary and Balearic Islands, not just the bigger cities, in terms of coverage for pre-existing conditions. So you come to us and once confirmed, will be able to provide you coverage, including your pre-existing conditions, so you have that peace of mind when moving to Spain, especially from another country or the other side of the world. The next important thing is our customer support. We value our customers and treating our customers with the most respect and helping them as much as possible in their language too. So first and foremost, we offer pre and post customer support and service in English, helping you with booking appointments, searching for doctors, helping you with any questions regarding your health insurance. So we're always there for you, as we understand moving from different countries all across the world to Spain, that the health care is different. It might be all new to you. So we're there to assist with booking appointments, searching for doctors, clinics, and any other questions you may have in a wide range of languages too. And just helping you and assisting you every step of your way on your journey to and currently living in Spain.
So thank you so much, Ciaran, for answering our questions today. You've been a wealth of information.
Thanks, Faye and Paul, for inviting me on and being able to be here with you today to help people provide information. And if anybody has any questions and is looking for a quote, has any questions regarding the health insurance policies, pre-existing conditions, coverage, anything at all, just reach out and we'd be happy to help you.
We're going to provide the link in the description below, so make sure you click on that one.
Thank you. Bye.
Thanks, Ciaran. Hasta luego. Okay.
Do we stop recording this time? We're good.